Hi, morning all. Thank you for joining this session about medicine as a career. We're just talking about your career or the way into medicine and how to progress through the different stages of your medical career in the future. There is a method for you to send me messages, which I can read, and hopefully I can feedback on those questions pretty much straight away. If there's anything I have missed, then I will try and answer those at the end, because we have got some time right at the very end as well to answer any questions as well. So I'm just going to share my screen now, my presentation. And hopefully you can all see that. So medicine as career and what to expect from it. So first of all, I am Nebi Jacob. I'm one of the orthopedic registrars in the Royal Berkshire Hospital. I've got the role of what's called a chief registrar, which is a role which gets me involved in things like today, which is teaching and training and providing people with insights as to what I do. I am also a final year trauma and orthopedic registrar, so what's called a ST8, so a specialist trainee year 8 in trauma and orthopedics. So I do trauma, which is management of fractures and acute injuries, and also orthopedics, which is more the planned operations, so things like hip and knee operations, hip and knee replacements, for example. And the chief registrar role is something that is attached to the Royal College of Physicians and helps me develop my expertise in an area outside the medical field, but gives me experience in things such as management and leadership and how I would function within the NHS as a future leader. And apart from my sort of formal role, so I am the dad of 2 kids here as per the last Halloween. So both of them were dressed up for Halloween and we went out trick-or-treating. So it's difficult to sort of think of yourself outside your sort of formal professional titles, but you are a person, you have got duties outside of your work life. So what do I do? So as I mentioned, I'm a trauma orthopedic surgeon. So this shows a setup in theatre, how we prepare a patient for a knee operation in a sterile field. But essentially the idea with any medical specialty is I help to make people better. And that's a lot of the reason behind why people go into medicine. They have the empathy, they've got the drive to make people better. And that's the reason why lots of us think of medicine as a career. And I think for most people, that's still your primary driver as to what makes you choose medicine as a career. Now, I get to play with power tools. So again, me being in the specialty that I am, I'm quite into my toys, my sort of mechanical toys, including pneumatic drills, electric drills, saws. We get to use new kits on a constant basis because we are always innovating in our specialty. We see new things coming out on a constant basis. Everything we used to use about 10 years ago, it wouldn't be used or hardly is used nowadays, and they're constantly innovating and striving to improve. So there's always this idea of you get to play with newer and better things constantly. And that's something that really interested me in my chosen field of trauma and orthopedics. I get to work with robots. So you don't often say that you get to work with robots in other occupations, but this is sort of a picture of robots that we use within our hip and knee operations. So I don't know if you can see that image on the bottom, but what we use is we use a CT scan to plan our operation. We plan regarding how our implants for a hip or a knee go into a patient, so where the knee replacement sits. And then the robot will then guide us as to where we make our cuts based on how we've planned it before the operation. And it's very accurate and shows that we can use, or this is the advancement that we have been developing in the field just to make our operations better constantly. We always strive towards improvement. I get to do lots of cool things. So again, being a doctor, I get to do things such as be on the medical team at Silverstone Circuit. So I'm a big fan of motorsports, and I'd happily watch motorsports all day. The fact that I can actually work as a doctor trackside, being in a safety car, and watch racing at the same time is an absolute dream for me. So I think, again, depending on your interests, you can always find something outside of your normal work which you can find which is interesting for you as well. So that's one of my highlights in what I do on a regular basis. Now, the chief registrar side of things, as I mentioned to you, that it is run by the Royal College of Physicians and is meant to be a way of you preparing you towards your consultant life and helping to bring about a positive change within the department that you work in. So it could be as simple as helping with things like administrative processes in terms of managing people in the department, managing your colleagues. If people have gone on sick leave, for example, how are we going to cover clinical duties? Or it could be as complex as you trying to develop a new pathway of how people could have a better quality or experience when they attend the hospital, to A&E or to your department, and make things better. You also look after things such as well-being of junior doctors. So I talk to my other colleagues and other junior doctors and say, what are the problems that you're experiencing? Do you have enough facilities around the house, around the hospital, whether it's got to do with things like availability of hot food when you're on call, availability of sleeping arrangements. If you are tired at the end of the shift, do you have a place where you can go and rest before you go home? I'm also involved with teaching and training on events such as today. I also organise the Physicians Associate training in addition with the University of Reading. I organise things such as the teaching for the doctors on our department as well. So again, you have, beyond your commitments as being a doctor and helping your patients, you often have a commitment outside of that to help others in your department, whether it's other doctors, other allied medical specialties as well. Now, how do I get here and where am I going? So medicine is something you do need a commitment towards, and it does take a while for you to get through. So it's something that you have to be sure that it's definitely something you want to do. So generally, as you know, you've always already done a lot of the hard graft towards preparing towards medical school and getting the grades you need to. But beyond that, if you were to streamline the process and get through all of these years straight away, these are sort of the minimum time periods you need. So medical school will take you a minimum of 5 years. After this, you go on to what's called the foundation years. And again, I'll run through these stages in the coming slides as well. But foundation years could be 2 years of different specialties. Core surgical training is what I went through. So surgical training, which again is another 2 years at a minimum. And then after that, you tend to go through specialty training, which is what I'm doing at the moment in trauma and orthopedics, which is 6 years after that. And then most surgical specialties, you have to go through a fellowship, which is, again, you training in an area that you feel that you want to go into. It's a subspecialty of your specialty, like trauma and orthopedics. And say, for example, I want to do hip and knee replacements, then that will be another 1 to 2 years of subspecialty training as well after that. So a long time. And between all of these years, again, people sometimes take additional years for more experience. They could take a gap year to do something else that's interesting for them. They could take additional years before they get through the competitive process, because each year you go between, say, medical school to foundation years, foundation year to core surgical training. The selection is a competitive process. So you are applying for the jobs and you are attending interviews for the jobs as well. So there is constantly a competitive process in you getting through these stages. Now, getting into medical school, and how do I do it? So subjects and grades. Now, this is a bit different from when I did it, but all UK medical schools have applications which you have to demonstrate good grades at multiple stages, so from GCSE onwards. So GCSE grades generally, from what I can understand, maths, science, and English, and but it's always a combination of your GCSEs, your AS levels, as well as your A levels, which they consider. Now, chemistry and biology at A levels is often or definitely required, but other science subjects are also often required, such as physics, for example. I understand that they can or they do accept good level A grade levels in other subjects as well. Um, Sometimes you may need to do a supplementary year as a foundation year prior to you getting into medical school, however. But like I said, there are lots of routes into medicine. And again, the main thing is that you have a constant aim to get the requirements you need to make your way into a medical field or into a university. Personal statement is a important part of your application, and these are things that you do. You apply, you show your grades, you do your personal statement, and this a big emphasis has to be placed on your personal statement. So you really need to have a really strong personal statement which shows your empathy. Empathy is one of the main factors which they want you to highlight on these personal statements, as well as showing your commitment to the field. So those are things you need to stress or highlight and spend time towards working on your personal statement um, as well. Don't try and rush and do this in a short space of time. Do spend the time to work on it and get it perfect. Ask lots of people to read your personal statements, and again, try and fine tune it as you go. And the personal statement is a personal statement, so it's not purely about the academics and what you've done in terms of your grades. It's about talking about you and what makes you different from everyone else who's applying for getting into medicine. So talk about things that you're interested in, sports that you do, hobbies that you're interested in, projects that you're working on, your involvement with sports, things like you being captain of a particular team, for example. All those things show that you are a leader and that you lead by example. And those are things, again, they are looking for. Things such as volunteer work that you've done, charitable contributions that you've made as well, campaigns that you might have taken part in. So if you're strongly for eco campaigns or campaigns around school or your community, which you have made a change or you have tried to make a change about something you're passionate about, again, that is really important for you to highlight in these personal statements. And as I said, last point is just take your time, just really don't rush it, and make sure that you have included everything in a nice, balanced way, which shows both your academic achievements as well as the things that you that are important to you. So talk to people you know who work in healthcare when it comes to getting work experience. I'm sure most of us will be in touch with someone in some form who works in something to do with a healthcare profession, whether it's in a GP practice, whether it's a phlebotomist, whether it's porters in a hospital, whether it's the nursing staff. Though I'm sure we can get in touch with someone, whether it's someone whose mum and dad in school works in one of these fields. It's very easy to talk to them, and they can really help you in terms of getting work experience. And again, it doesn't have to be in a hospital or GP practice. It could be even a nursing home, care home. All these are very valuable experiential time that you can spend towards improving, again, your personal statement, something that you can put on there saying that you have made that attempt to go out of your way to get an experience in a relevant field. And even if you don't have anyone who you can talk to or that you know directly in healthcare, you can call the GP practice locally to you, or a nursing home, a care home, or sometimes approach the hospital and see if there's any way or avenues for you to get into and have an experiential time in these fields. Sometimes made tricky by COVID and how many people they're allowing to come in for these things. But again, there's no harm in asking, so to do ask, and I think that's very important. And shadowing itself can be in any role. Again, it's more about the fact that you have had that experience in a healthcare setting. Now, these are the assessment tests which they use as part of your UCAS application. So UCAT, which is the University Clinical Aptitude Test, which is, I think, the majority used in most of the universities, or the BMAT, which is the Biomedical Admissions Test, which is also, I believe, still used in a few universities. And essentially, the idea is that it's checking your suitability for the profession beyond academics. Because as I said, it's not purely just the academics which are important. It's you having the right aptitude, the right approach to doing a profession like medicine. So they look at things such as verbal reasoning, so your evaluation of a topic. So they may give you a essay, for example, to read, and then you critically evaluate it and provide your feelings on that particular topic. The decision making itself, so they may provide you a difficult, complex scenario in which you have to make a decision. And again, they look at your decision making, and often it's not there being a right or a wrong answer, but it's just trying to decipher how you make that decision. Quantitative reasoning, which is relating to you assessing numerical data. Abstract reasoning, so thinking about your thinking style and assessing that, and also situational judgment. The BMAT is a fewer number of sections. These include critical thinking and problem solving. This is a bit more academics inside it, so biology, chemistry, physics, and maths involved, and writing skills. So they often ask you to write an essay and give you about 30 minutes or so for you to write the essay itself. Now, medical school itself, it's variable depending on universities, but the majority of universities still have medical school where they have 5 years of training, where 2 years are preclinical years and 3 years where you have more clinical specialties, where you're actually also given placements in the hospital as well. Some universities have gone to a problem-based learning approach as well. So they have changed the approach from being a preclinical and clinical to having clinical placements throughout the year as well. And another thing, if you are interested in, is intercalation. So some universities offer intercalation, so an option to do an additional degree at the same time as your medical degree, so like a BSc or an MSc or an MRes, which you can do in one extra year. And it is a good thing to do, because you can either choose to do something which broadens your horizons by choosing a field completely separate from medicine. So you can choose any topic of interest to you, or you could actually say, actually, I want to look more into detail with one particular field of medicine that interests me, and then choose the subjects related to that, and then do your MSc or MRes related to that specialty as well. So it's really good. And with one extra year, you can actually do an additional degree at the same time. So again, something to think about. And if it is something that you are interested in, you need to think about the universities you're applying to as well, because not all of them necessarily offer intercalation. Now, tips and tricks regarding medical school. I mean, everyone's different. Everyone has a different approach to it. But from my point of view, getting the work and social life balance right is important. Some people go into university and think, okay, right, I need to sit down and study for this whole first year. And they go in for the whole first year and sit down and study. And then second year around, they realize, okay, they missed out on a whole lot, and they're going to do a lot more social things. And they do a whole lot of social things and miss out on the educational aspects. So it's always best to try and get a balance of both. So if you can try and sort of timetable in, or get an idea of how much time you're going to spend towards getting the work done and how much time you're going to spend towards social life, then that's probably useful. Now, societies, so joining societies, whether it's to do with doing medicine, whether it's sports, whether it's educational, quiz, trying to get involved with something or the other, whether it's medical or a non-medical society, is an excellent idea. And the sooner you do it, the better. You'll make friends, it will help you settle in quickly into university. And sometimes, again, leaving things later means that you often miss out on opportunities that you could have had much earlier on. So I think, again, that is something that I would recommend. With regards to medical school, some people go in thinking about what specialty they want to do, and thinking that they want to do one specialty right from the get-go. But sometimes it doesn't matter if you don't have that clear plan, and you can always think about things later on, and you can take the time. And again, you've got both your medical school as well as foundation years to decide. Sorry, I just want to check if I have any questions at all. So no questions so far, so let's carry on. Now, training within the NHS. So what you've finished your medical school, so you've finished your 5 years, 6 years of medical school if you're intercalating. Then you go into getting into the NHS and beginning your training as a junior doctor in the NHS, which is where I am at the moment. So from medical school, you go into your foundation years. That's the topmost box. So as I mentioned, that is 2 years, and you generally have a mix of different specialties. So the idea of the foundation years is to give you a broad-based experience in multiple specialties. So you tend to have a mix of surgical specialties, so trauma and orthopedics, general surgery. You could have general medicine, acute medicine, emergency department, general practice, for example. And along with those times, you also get time to talk to your director of the program, and you can actually organize experiential years. So you could choose to, say, for example, spend a couple of weeks in radiology or microbiology or other specialties which are less common to get full 4 months placements in. And again, if that's something you strongly feel that you wanted to go into and have experience of, you can actually get or request some time in those specialties as well. So after the foundation years, as I mentioned, you can often ask for an extra year, so foundation year 3, as it's called, to again get more experience in other specialties as well. But that's essentially when you decide where you want to go in terms of your training. You usually have a rough idea by that point as to whether you want to go into a medical training, so a general medical route, or say rheumatology or cardiology, for example, or you want to go into a surgical route, so towards trauma and orthopedics, general surgery, vascular surgery, etc., or GP training. So you could go straight into GP training, which is 3 years, or into more acute care common STEM, which gives you an opportunity to go into things like anesthetics, ITU, emergency department care, for example. Apart from the GP training, for all the other 3 boxes, you essentially have further routes into other specialty trainings. And as I said, like what I did from core surgical training, you essentially have to start applying for your specialty training in orthopedics. So then you have a further 6 years of orthopedic training. And similarly, you have similar sort of different time periods for specialty training in different medical fields and the emergency department or anesthetic fields. So it can vary from being roughly 4 to 6 years of specialty training, apart from the GP training, which after 3 years you have finished your training. Apart from if you have chosen something like an academic route. So all these specialties, again, you can choose to be an academic, so you can choose additional years to do academic work, whether it's an MD or a PhD, or timeouts during your years of training as well. So you're starting to get the idea that this is quite a long route, so it can take a long time. And as mentioned, there is time between these fields for you to take gap years, whether you want to go abroad, get some experience in other countries, take experience outside of medicine, for example. If you haven't made your mind up about which specialty you want to do, you might choose to locum or do something else for a year or 2 before you decide your route as well. So there are multiple stages where you can take additional time. So talking about a week in the life of an orthopedic registrar. So what is my normal week like? So generally you have quite a fixed plan. You tend to be attached onto a one consultant or two consultants in your department. On an average, in the Royal Berkshire Hospital, we work about 1 in 16 weekends, so probably 3 to 4 weekend on calls per year. And you probably have about one night on call every 2 or 3 weeks. So not a terrible on-call life from that point of view. So that's relatively infrequent. From a day-to-day point of view, the timetable below is what I've sort of written as to what I generally do. So on Mondays, I tend to have a clinic in the morning, what we call a fracture clinic. So we deal with people who have come in with fractures through accident emergency and have been referred for further management. So they come to our clinics and we essentially treat them or just make a decision as to their further management, whether they need to go in another cast, whether they need further x-rays, advice regarding how they can, say, for example, put weight through an ankle or not, or whether we have to keep them on crutches for a bit longer. And we also review the x-rays to see if the fracture is united or not. And we have a plaster room next to our department, so they apply plasters for us. And we also have an x-ray department very close to us as well. So the setup is in such a way that we try and give the patient an area of the hospital where we can do everything we need for them to manage them in the fracture clinic. In the afternoon, I tend to have an elective theatre session. So we tend to do planned hip and knee operations for patients. On a Tuesday, I would have an admin session, so time to catch up on emails sent to me, patient letters, so letters to the GP that I need to review and make sure they are entered, typed appropriately, and make any changes are required. In the afternoon, I'll have another clinic. Wednesday mornings, generally, I would be on call, so I'd be the first on call, so I would get referrals from A&E for advice on management of patients. I would generally have an SHO, so a more junior colleague, on with me at the same time, who's also got a bleep, and between us, we manage those patients who come in through the emergency department. After handing over the on-call around midday, that would then make my way into clinic for an elective clinic in the afternoon. Thursday mornings tend to be trauma theatre mornings, so tend to do operations on fracture fixations. Thursday afternoon, another clinic, and Friday all day tends to be my planned elective theatre sessions all day. Just a rough idea. So again, things obviously vary week to week, but that's generally how a breakdown of a general orthopedic registrar's week would be. Now, from a day-to-day breakdown point of view, we do start early, so surgeons in general always tend to start at 8 o'clock. At the Royal Berkshire Hospital, we have our trauma meeting, which is a meeting where we discuss all the patients who have come in acutely in the morning, which starts at 7:45 in the morning. And we go through with a couple of consultants, including the on-call consultant and all the registrars who are present, along with SHOs in the room. We discuss the cases and decide on the best management for the patient prior to us actually doing the ward round of all the patients as well. We also make a plan for the theatre list for the day to try and decide as to which patients take priority and which order we need to do the list, and decide on what equipment we need to have available for that case as well. So we need to discuss and sort of brief the whole team regarding what our plan for the day is. By about 8:30, we tend to have finished that meeting. We take the on-call bleep and do a PTWR, which is a post-take ward round, and review all these patients that have come in during the day and overnight. 9:15, we have a board round. So we have a trauma ward where all our trauma patients generally are admitted onto. So we go onto those ward rounds and discuss again all the patients who are on the wards, and try and make a plan for patients to either have a discharge plan if they're ready to go home. If there's anything delaying their discharge, we talk about the things that are delaying the discharge to try and speed things up, or if there are any problems with the patient that need to be sorted, then we talk about how to manage them in terms of whether it's something to do with they're a bit anemic after the operation and they need a blood transfusion, to them needing further input from another department, such as the medical team, for example, with complex medical issues. We are very fortunate to be supported by a separate medical team as well to help manage these patients. Now, in the afternoon, if I'm going on, for example, to a a theatre operating list, for example, then I have to go down to the wards and consent to taking permission, a written permission from patients to do an operation for them, and trying to explain to them the benefits of the operation versus the risks of the operation. And essentially, it's a legal requirement for us to do an operation to get consent from the patients. So we tend to aim to start an operating list by about 1:30 in the afternoon. Again, we have to go to the theatre, brief the theatre team, make sure we're all on the same page in terms of patient order, equipment, make sure we have the right equipment available, and then plan to start the operation. On average, a theatre operating session finishes about 5:30. Manage to review all the post-op patients by about 6 o'clock, and hopefully home soon after. And again, let me just check if I've got any questions. So just a couple of questions regarding volunteering or extracurricular activities did you do for medical school entry? So essentially, for me, I wasn't a captain of any teams or anything, but I did take part in sports with tennis and football, things I did. So those are things that I took part in. And again, the fact that you were part of a team itself and involved with team working was useful. And again, something that I could put on my application. What sort of volunteering? So again, I had the benefit that my family have got a background in medicine as well. So that my parents are both doctors. So I was able to approach them for help in terms of going in and shadowing the medical teams in the hospital. So that was the main thing that I did in terms of shadowing. Volunteering wise, I was involved with work in the church. So I used to go help them as well and volunteer with charity work, for example. So those are the things that I put on my application. Societies wise, again, things such as sports was my main interest in terms of societies. But again, whether it's to do, lots of my friends did things such as whether it was being involved with the choir, with music, involved in the band. People who were involved early on with those societies have, even now as sort of doctors, carried on and done things with music and being involved with orchestras and things. So I think, again, that's entirely depending on your interests and what interests you in your in a day-to-day point of view, and what sort of background you have is what societies you want to be involved with. So choosing specialty, I had from an early age, or soon when I joined university, decided I want to do trauma and orthopedics. But when I got into foundation years, I actually found that I did most of my specialties in general surgery. So once I started doing that, I actually, when I did my core training, decided that I wanted to do general surgery. So I chose a themed rotation in general surgery. But once that happened, I soon after realized that it wasn't for me. So it's completely fine for you to decide that you want to do something, and then you try it and see it's not for you, and you can change your decision at any stage. So there is nothing stopping you from making that decision. Okay, so I think essentially it depends on your experience and what you want to do. Does age matter when choosing medicine after a career change, after a couple of years post-graduating? I don't think age matters at all. I think it's purely depending on where your mindset is. I think as you get older, things like your priorities also change. So it depends on what you want to do. I know a colleague of mine who's in trauma orthopedics who actually started off doing nursing. So she did nursing, and then she became a theatre scrub nurse, a senior sister in theatres, and then eventually thought, actually, I think I can do this better than some of these people who are operating. And then she moved to doing medicine, and then is actually an orthopedic trainee who's actually come off the top end of orthopedics and doing her fellowship in orthopedics at the moment. So no, it doesn't really matter what age. Obviously, there is a balance, because as you get older, you've got other priorities. So you've got your family and other people who are depending on you as well. So you just need to think about how that's going to impact you as well. So I think there are other factors involved apart from just your age itself. how do you think that backlog of surgeries caused by the pandemic will be dealt with in the future? Um, I'll probably answer that at the end as one of the last questions, as obviously it's less relevant to actually the day-to-day functioning, but it's obviously a very relevant question, which I'm happy to answer as well. So I'll answer that. And are the Royal Berkshire currently offering any in-person work experience? I They are definitely. We always have volunteers, and I always see people, whether it's with our porters or with our volunteering team, the reception team at the front, who have been doing work experience. If you want, I can provide my email at the end of this talk, and you can email me, and I can try and help you out through our relevant department. So I can provide my email at the end of it. Okay, so it's carrying on. So things I love about my job. So obviously, like I said, there are lots of things to love about medicine as a career, and the things, as I mentioned before, including what I do from a day-to-day point of view, I love. So the fact that I get to operate is one of my main things. That's my happy place. I love being in theatres, and I love doing my operating, even if I finish early, start early, finish late. I'm really just happy to be in an operating theatre. And again, it depends on your personality and what you want to do. But for me, the technical aspect of an operation really is one of the main drivers for what I do. Um, from an orthopedic point of view, patients notice a difference in a short space of time. So people come in a lot of pain before a hip replacement, for example, and within a couple of days, you've done a hip replacement, and they're mobilizing a lot better and much less pain and a lot happier and have a much better quality of life. So that, again, is a major driver for me. So other thing are team working. So every day in working in a hospital, I come in contact with multiple professions. So as I mentioned to you, when it comes to a trauma meeting, it's us as orthopedic surgeons involved. There are anaesthetists who come to the meeting. There are trauma nurses who are there. There are the other nurses on the wards, matrons from the wards who are there, scrub nurses who are there in theatres who are helping us or assisting us with equipment and getting things ready for surgery. They're all there. On the wards, you talk to the physiotherapists who help get your patients better and mobilizing and out of the ward as quick as possible. You've got the occupational therapists, which are the OTs. So again, they assess the patient and the suitability of their home, and if the patient can go straight home or whether they need sort of interim care to get them rehabbed and ready to get home. You've got the healthcare assistants who actually help the patients day to day in terms of self-care on the wards. So there are a whole host of people involved in the care of every single patient that comes through. And it, again, even from the front reception desk, so you've got receptionists at the front desk, to the doctors in the ward, the nurses in the ward, everyone makes a difference in that patient care journey. So it's very important to involve both of them and be courteous and helpful to all of them in your job. Management of acute trauma. So when I am on call, I'm part of what's called the trauma team. So when acute trauma comes in, someone who, say, for example, has a car accident and has multiple injuries, they put out what's called a trauma call. So the ambulance or the helicopter, for example, may call an emergency call saying, okay, we've got a major emergency coming through the door to emergency department in 10 minutes time. And the emergency department then puts out a trauma call, which comes through the bleep and says, okay, all of you need to assemble now to emergency department in 10 minutes. This patient is coming in through the door. So essentially it involves a big team of, again, emergency department doctors, orthopedic doctors, general surgical doctors, anaesthetists, nurses from the A&E, the x-rays, so the radiographers from the x-ray departments to get the images required. So again, everything is a well-oiled machine to try and optimize the care for this patient. But there is, again, the adrenaline rush of being in a situation where a patient may be acutely unwell and you are saving their life by being that sort of well-oiled machine, that team, which helps to get that patient better. And again, it is a multifaceted occupation. So you being in medicine doesn't preclude you from deciding that actually maybe clinical medicine isn't for me. So maybe I want to do something different. So again, I know friends of mine who have chosen to leave the medical profession from the point of view of clinical work, but have chosen to go into pharmaceuticals, for example, or other specialties which they don't have as much sort of face-to-face contact with patients. So they might choose to do microbiology or pathology, which you still have to have some degree of patient-to-patient contact to get context of the condition, but you don't spend the same amount of contact as you would do by doing multiple clinics in a patient-facing specialty, for example. So there are lots of different options of how you want to choose the specialty that you want to go into, or the route you want to go down. And again, you could also choose to go down further on up the line. As you go up the line, you could choose to go into a medical director role or a clinical director role, again, which has more to do with patient care planning and optimization of pathways, but not necessarily direct involvement of patient care. But again, you have the role of having a role in improving patient care on a large scale, rather than you having a direct involvement from a face-to-face point of view. Now, challenges in my job, as with all jobs, there are challenges. So as you can see, it's a long training period. So I graduated from medical school in 2008, and I am in my final year of my training now. So a long time, and I've still got what's called fellowship training left. So 1 to 2 years of subspecialty training as well. So it's a long route to go through when you consider what you've been through over the years. So if you have to maintain your motivation throughout the whole period, and you need to not lose sight of your final end goal. The next challenge I sort of mentioned is maintaining a work-life balance, because you have to identify your priorities, and it's always important to balance that work and life aspect of things. So priorities do change over the years. So as I mentioned, when I first started, obviously you're on your own, you do the things you enjoy, you've got people around you that you love, you can do the sort of hobbies that you want to do. Over the years, you get family, you have people dependent on you, so your priorities do change. Again, it's important, even as having a family and people dependent on you, you try and continue with things that you're interested in, which keeps you a rounded person outside of the specialty or the medical field itself. The other thing is, sometimes it feels like you're fighting the system. So the NHS itself, your training, all of it is quite a complex system. So you need to navigate your way through that system. So you need to try and identify a way of getting through that system in a streamlined process. You need to identify the things that you can fight or you need to fight and trying to make an immediate change, and the things that you may not be able to change immediately, but be able to work on the process or help towards making a change. So it's quite important to sort of realize where to focus your energies, if that makes sense. Next is being prepared to change location for training needs. So me, during my training, so I started off doing my foundation years up in the Liverpool, Manchester area. So then I got a core training job, as I mentioned to you, wanting to do general surgery initially. So I moved down to the KSS deanery. So I moved down to Brighton. Then I realized that it wasn't for me. So then I moved back towards Mersey to carry on my orthopedic core training. And then I eventually moved back to Northwest London, which is where I've been since for my specialty training. So you can move quite a lot in your training. And obviously, if you're lucky, you may never have to move. But you have to be prepared for that. And even, say, for example, at the moment, I live in Northwest London and I work at the Royal Berkshire, so I travel about an hour, 15 minutes each way. So that means an early start. So I leave the house by about 6:15 every morning to get to work. So again, there has to be the understanding that you could do quite long days, quite a lot of commutes. You may have to change location. Even some of the bigger deaneries, bigger sort of geographical areas where the training happens, the area where you live to the area where you get placed in hospital may be quite far apart. So you might need to move for that reason. Around London, generally, we're quite lucky and we can sort of generally commute from where you decide to base yourself to the hospital of your choice. The last thing, I guess, was using personal time to attain training needs. So apart from your using the specified time within work, you often have to achieve other goals. So obviously you have to get your exams at different stages. So whether it's your basic surgical exams like the MRCS or the MRCP for the medical exams, or your final exams, so the FRCS for the surgical or the FRCP for the medical, for example, you have to sort of make time for studying in between all of these. You have to make time for you going to courses in between all of these. You have to make time for you doing assessments for you, showing your progression throughout the years as well. And all of these is in addition to your working time. So those are things I've sort of challenges I think that are present in your job. And I guess last thing is just sort of just saying that in the end, it's sort of like finding the right shoe for you. It's not necessarily just about the size, it's about the fit, it's about the style, it's about what works for you. So it's you trying to decide, one, what university is right for you when you apply, what sort of societies you choose depending on what you're interested in. Whether you choose a specialty that is surgical or medical is often depending on how you feel, your hand-eye coordination, your mentality towards things, and also other things outside of that as well. So things about, like I said, age, how sort of long you want to be in training, the people around you, the support that you have. So all these things help to decide on which route you go down. And again, there's no right or wrong answer. It's about finding what works for you. And again, you might find that you work your way down one route and realize it's not for you. And again, changing tack and going to another specialty, you can decide at any stage. So people do that quite late on in their training as well and change to another specialty. So that's completely fine as well. Okay, let's try and catch up with any questions that I have had in the meantime. So, okay, we mentioned about backlog of surgeries caused by the pandemic. I think at the Royal Berkshire, we've been sorry, I'm not sure if am I still muted? It's written host muted your mic. I'm not sure if this is working or not. Okay, sorry, it seems to be working. So in terms of the backlog of surgeries, I think the Royal Berkshire has been very lucky in terms of we've been able to restart our elective operating quite early on. As a result, we've pretty much been able to catch up with our backlog. There have been ways of us trying to catch up by using the private hospitals around the area. So our doctors, both trainee surgeons as well as consultants, going and working in private hospitals, which the government organised, so that we can actually carry on with our elective surgeries as much as possible. So I think that has been the major way of us trying to catch up with our backlog itself. So I think obviously it's going to take time, and I think in the future we will have to appoint more surgeons to catch up with that backlog as well. So I think it's inevitably going to happen, but I think at the moment it's still sort of in a situation where decisions are being made but haven't actually been finalized completely. So we are catching up, but it's still not fast enough at the moment. What was the thing that you found hardest in university? So I would say that the fact that you are in a different environment, for me, I went from being at home to being away from home, trying to find a balance between socializing and work. And that's probably the right sort of the thing that I found most difficult. Sometimes I felt, okay, I need to sit down and get studying. But often at the same time, you lose out on opportunities because societies and socializing isn't all about necessarily you just socializing, but it also gives you opportunities of meeting people who have similar interests. And often you meet these same people who you met back then throughout your career in the future as well. So the fact that you could bump into them and just sort of easily sort of ask them a question and say, okay, actually, what do you think about this? And again, me being in orthopedics, I might find someone who actually, for example, is doing a medical specialty or happens to be in a field that I have a question about, and I can just approach them directly and say, actually, what do you think about this? So I think that's sort of been the benefit of it. But yeah, finding the balance is often the most difficult thing. Now, how do you ensure that patient care is unified across the multidisciplinary healthcare team and that every team member is listened to? Lizzie, as you mentioned, I mean, we have what's called multidisciplinary team meetings nowadays. So essentially, there shouldn't be any reason for one person to be heard above the other. So the idea of these multidisciplinary team meetings is that everyone gets a say to make their voice heard and make sure that the patient gets the best care. So in the end, that is our aim for the patient. So with these multidisciplinary team meetings, there is time allocated for everyone to have their say about a particular patient, a particular topic, and that's usually where people get the forum to discuss regarding that. Regarding every team member being listened to, I mean, there are different mechanisms of that happening. I mean, even within a hospital, we were talking about this recently at a meeting. So sometimes people often block people's opinions without actually realizing it, so they might sort of somehow you obviously do come across people with different personalities in your work. So some people have quite strong personalities, some may actually hold back a lot more with regards to what they say or may put out there. So essentially there needs to be a way of that being expressed to them, or if someone has had an unpleasant experience, there has to be someone they can approach so that it could be made sure that the person who made them feel in that particular way knows about that. So there are sort of feedback mechanisms available, or at least we're trying to implement some of those mechanisms at the hospital. But yeah, I think the multidisciplinary team is where you sort of make sure that patient well-being is ensured. But if it's to do with things like how people responded to you, or if you have necessarily an altercation, not necessarily an altercation, but a disagreement in one particular way, it's important that each of you know how you feel about that particular episode, and that's fed back to that person, for example, without being abrupt, is probably the word to put it. So different hospitals have different ways of doing it. How do you cope with exam stress? Difficult question. I think I'm one of those people who actually is probably good with exams in terms of I don't stress too much about them. My wife probably thinks that's a negative thing, so she always is the one who's nagging me to keep on studying. And when my exams were coming up, especially for my final exams, which were about 1.5 to 2 years ago, but everyone's different, and I think for me it was just trying to sort of dedicate some time towards sitting down and reading, but at the same time you having time away from that studying so that you can clear your mind as well, and sort of when you're concentrating, put your full concentration into it, and when you're not, you do things that you enjoy to try and relax your mind outside of it. Okay, I think I missed one question. Advice for the grad entry route. I think, Raf, I think there's all routes into medicine are competitive. Through the grad entry route, I think, again, I don't have experience as such through it, but again, it's making sure that you have a good personal statement, and making sure that the time that you've spent towards applications is a useful one. So every year that you have spent, you have to be able to not necessarily justify, but you need to be able to say why that was useful towards you preparing for your medical career. So I think that's the main thing. You just need to be able to say that I did this during my time. This is why I did it. This is what I gained out of it. And this is going to make me better because of this reason. So it's going to help me in my future, because I've had this experience with which a lot of other people haven't had, and that's made me a better person. And I think that's what you need to say. Okay, are there any other questions at all? I think I've gone through all of them. So, Steph, about issues experienced by ethnic doctors. So, recently there's been a big push towards giving equal opportunities to people with different ethnicities. We in the NHS are very lucky because we have people from a wide variety of backgrounds. And I think we are very, very well represented in the NHS. I think, again, there is still a problem with higher managerial levels or higher levels of management within the hospital still being quite lopsided when it comes to these, which is shown up on surveys. And I think, again, the whole purpose of things such as the Chief Registrar Programme and other sort of fellowships with clinical leadership and management programs is to develop sort of the next generation of leaders. And again, as you work your way through your career, again, there will be multiple opportunities for you to be involved in it. And I would recommend that you involve yourself in these things, which helps you to be involved as a future leader of the NHS and really have that opportunity to sort of shape where the NHS is going in the future. So, Zion, about applying for university, what would you say the impact of grades is compared to your own personality? What do they look at more? I think what they're looking for is a well-rounded individual. So that's part of the reason why they look at sort of GCSEs, AS levels, A levels as a whole. So they want to make sure that it's not just like a sort of single stage where you have excelled. You need to be consistently performing. But at the same time, I think grades are very important because it is quite an academic selection still, unfortunately, into the field. But lots of people have got those grades, especially with what's been happening over the last couple of years with COVID. And I think what needs to be done is that you have to show that you are different and you show that you stand apart with that personal statement. So the personal statement is for you to show that you are different from everyone else who's applying. So I think you need a combination of both of them. But you can make up for small sort of slightly lower grades in one thing by, say, for example, your personal statement and things that you have done. But again, grades are very important for the application process as well. So, university-wise, where do you go? How did it affect your career as a surgeon? So, strangely enough, my university actually I did abroad, so I didn't actually do it in the UK. So my family I grew up here, and then my family all moved abroad to India. So at the time, I did my higher secondary schooling there, and then moved to university there as well before my family all moved back. So lots of the feedback from when it comes to things like university has been from my wife who went to UCL. I think regarding how does it affect your career as a surgeon, I think the university itself doesn't necessarily have much of an impact as to your further training. I think the part that you really decide regarding your surgical training is generally when you actually start core surgical training. You find that you develop an area of interest. So like I said, again, as a foundation doctor, I did lots of surgical specialties, but mainly general surgery. So you tend to be driven by people around you who you find interesting, the operations that you see, and what's interesting as a result of that. But again, when you actually start doing the operations, which tends to be when you are in core training sort of level, is when you actually decide if you actually enjoy that type of surgery or not. So I think university itself, you may find people who are interesting to you, who you may want to be involved with things like research and so on. but it doesn't necessarily decide what surgical specialty that you want to go into. Matty, about getting work experience abroad. Yeah, definitely. I think it doesn't really make much of a difference in terms of work experience. I mean, the main thing is you do have experience in a healthcare setting or in some sort of a healthcare background. Like I said, it doesn't have to be in a hospital. It can be in a care home, nursing home, anywhere. But again, it's trying to show that the combination of work experience is important, but also you being, say, for example, volunteering or doing charitable work or doing work from that point of view is also important. So the NHS, as you know, is a healthcare service where we pride ourselves on providing healthcare for everyone and providing it equitably to everyone as well. So having that or showing that you have similar sort of ideals is also quite important. Okay, I think, hope that's our time up. And if there are no other questions, I think that'll be the end of the session. Thank you so much for attending, and please do contact us regarding work experience. I think the emails come up on the side that you can email, and if you can provide any feedback through the survey link, that would be useful as well.